G'day and welcome back to the channel. So today's video is all about how to resolve knee pain when sitting cross-legged. So if you are someone who does find that your knee or knees hurt when sitting on the floor cross-legged, or you're sitting up in a chair and try and cross one leg over and your knee hurts as well, I want to show you 3 different exercises that you can do that has the potential to instantly change how your knee feels. And the twist is that none of them are knee-specific exercises. So let's get into it. So the first and potentially most important piece of information to get across in this video is that if your knee hurts when trying to sit cross-legged, your knee pain may be a consequence of a lack of rotation at your hip. The idea being is that when you are sitting and trying to rotate your hip externally, that external rotation of your hip so that your foot clears your other leg, or in this instance clears the floor successfully, if you are missing some of the rotation at your hip and you can only get a part of the way, then you may be trying to find the rest of that range through a knee that should be bending as a hinge and not twisting laterally. So it's important to understand that if your knee does hurt when sitting cross-legged, you might be missing some hip external rotation. So naturally, the 3 exercises we're going to go through will hopefully address 3 different aspects of the same problem. One is a muscular stretch, one is a hip capsule stretch, and the third is using a ball to go looking for global soft tissue restrictions. And if you're a member of the channel, once we get through one of the muscular stretches, I want to show you 2 extra variations that you can do. So you've got some different options to figure out which one is the best version for you. So let's start there. So the first hip rotation exercise that I think we should touch on is an exercise that helps reduce some of the muscular tightness that might be limiting your ability to cross your legs effectively. But before we get to that, the theme that I want you to keep coming back to with each one of these exercises is we need to base everything that we do on results. So before you attempt anything, please sit on the floor and try and sit cross-legged, see how your knee feels. Sit in a chair, cross your legs like you normally would, and just see how that makes your knee feel first. The first exercise that I want to touch on is very simple, and it's very similar to the thing that you've been testing, is we want you to sit up tall and do a seated hip rotation stretch. But the difference is, the way that we can do this without annoying your knee, is we can cradle your knee to take the tension out of it. If you struggle to get your knee up, have this other leg down a little bit further first. As you get better, bring it up a little bit higher. But for me, as a demonstration, we want you to be up tall. From here, bending forwards from your hips. So we're not just leaning forwards, because for me, I can keep my back straight, hinge forward to here and find a good chunk of muscle tightness at the back of my hip where that back pocket is. I can definitely get all the way down here, but it all comes from my back. So don't judge how good you are by how far your chest goes down. Judge how good you are by how straight you can be until you feel that tightness in your hip. And then from here, to make this more specific and more optimal for you, when you're in this position, you found your limitation going forwards, gently twist your trunk towards your knee or twist your trunk towards your foot to see which version of this exercise is best for you. So for me, I traditionally feel the best version of my tightness twisting a little bit this way. Once I've found the tightness, the next thing we need you to do is we don't want you just to hang out here for 30 seconds. That is no longer good enough. It doesn't make the immediate changes that tensing up that tightness does. So once you've found your tightness, try and find a way to squeeze where that tightness is. You may need to push this leg down into your other leg to make it work. Hold that for 5 to 10 seconds. The idea is when you stop tensing it and maintain this position, that tissue will instantly give to some degree. From here, you should then feel you can go a little bit further into the stretch than you could before repeating that same process. So you can keep doing this until you either get sick of it or you stopped making change. And then immediately once you've done that, sit cross-legged, test that out, and then let me know in the comments down below, did you find an immediate difference straight away? So if you remember, the next thing you'll see is the extended version of this video. So once you've addressed some of the muscular restrictions that might be limiting your ability to externally rotate your hip and keep your knee out of the equation more, the next piece of the puzzle that we need to explore is what's going on underneath those muscles, more specifically through the hip joint capsule. You may or may not know, if we have your hip joint, which is a ball and socket joint, and we wrapped that joint up in like a plastic wrap before we put all the muscles over the top, that's essentially what your hip joint capsule is. And again, thanks to a lot of the sitting we do and a lot of the static positions we get into, those hip joints and those hip joint capsules can become restricted. So in the spirit of trying to figure out what's making your knee feel sore when you're sitting cross-legged, we also just want to make sure we look at your hip joint capsule with a bias towards hip external rotation. So what I would like you to do this time is, again, being on the floor. And obviously we want to make sure we pay attention to how you feel with your knee in this hands and knees position. But if we're doing this hip, we want you to be on all fours take the opposite leg back temporarily. We're going to take the hip that we're stretching. We want to externally rotate that hip, which in this position means sliding your foot underneath, not going the other way, which some people intuitively do. We want to slide that round. We want to drop your back leg to really hopefully push and assist you in that position a little bit more. We want to take your shoulders and your hips together and slide your trunk horizontally to the side that you're trying to mobilize. And what we're looking for is we're trying to imagine that your thigh bone is respectfully pushing out the back side of your hip, more so towards that back pocket. We're shifting across, we can shift back, and we're just looking for a pressure for 30 seconds, 60 seconds, 2 minutes, whatever you feel is comfortable and tolerable for you. Obviously respecting how your knee feels being in this position. You can put your knee onto a towel or a pillow if the pressure is a little bit uncomfortable, but if we can explore that hip capsule and just give it time to give and release and free up, like we've done before, if you then can immediately recheck how things feel straight away, you should instantly feel that A, there is immediately more hip external rotation available for you. And if that limited rotation is affecting your knee, perhaps your knee might start to feel a little bit better straight away. And then once we've started to work on some of the direct muscular restrictions and potentially some of the deeper hip joint capsular restrictions, the next thing we can do is grab a ball and go looking for what might be left over. So for the third piece of this puzzle, if you can find a lacrosse ball or a tennis ball or something round and comfortable that you don't mind jamming into your butt tissue, and we're going to take that ball and we want to find the bony bump at the side of your hip, which is one of your hip bones. If you place the ball on that bump, but come immediately back from that towards your back pocket, we're going to get you to lie on your back and just gently roll over onto that side. Because with your hip bent up in this similar rotated position, what we can gently do is put as little or as much pressure through that as you feel comfortable. Most people's tendencies are to sort of roll up and down because it's a ball. What I'd like you to do instead is just gently roll onto the ball, leave the ball there, let it press into that soft tissue. We can trigger point some tight muscles. We can improve your hip external rotation in that way. On top of that, we can do the same thing that we did in the muscular stretching, where we sort of tense up that muscle for a couple of seconds so that when we relax it, that tissue will give and the ball might sink in a little bit deeper. It may not feel as tender as it did straight away. So please hunt around, up and down from that spot, go down as low as you need to, go more towards the back, come a little bit sort of higher up into the hip if you can. Again, find a tight spot, give it a squeeze for 5 to 10 seconds. When you relax, it'll give, it'll sink in easier, it might be less tender. But from here, what we can do to make it a little bit more specific to hip external rotation and increase the chances that we're going to improve how it feels to sit cross-legged. Once you've found a particularly tight spot, what you can do is keeping your thigh in the position that it is, we can externally rotate that hip to try and shear that tissue past the ball. And the benefits of doing this, of just rotating around until it frees up, finding another spot, keeping your leg in the same position, hip externally rotating, is that not only will we be sort of reducing some of the muscular restrictions, but if there are any other restrictions through the fascia or the skin or the different layers of tissue that should move when you move, we're trying to encourage anything and everything to free up. So we're not just looking at this through the lens of like tight muscles or a stiff hip joint. We're paying attention to everything around that we can find that feels meaningful with the ball. And then once you've done that, we need to immediately recheck things. And as you can hopefully see, the ability for my knee to drop down is improving. It's feeling looser. It's not feeling as tight as it is on the other side. I don't feel particularly tight in general, but it just feels like there's so much more room to move here than there is on the other side at the moment. But please don't take my word for it. Base this on your test and retest. Let me know in the comments again, which one of these three do you feel has improved your ability to get into this position the most, and which one maybe makes your knee pain feel a little bit better straight away. So at the end of the day, it's really important to appreciate that knee pain is typically a consequence of something else. And if you're someone who has always had a sore knee when trying to sit cross-legged either on the floor or in a chair, there is a decent chance that the reason why your knee hurts is because your hip is lacking some of the rotation needed for your knee to feel happy in that position. And while specific knee dysfunction can absolutely be a piece of this conversation, how much you expose that dysfunction in this position has so much to do with what's going on above that knee. And whether it's the muscular tissue, the joint capsular restrictions, some of the soft tissue or the sliding surfaces around that hip, any or all of those could be contributing to why your knee feels sore when doing something that you deserve to be able to do. It's always important to reassure you that sitting on the ground is normal, sitting on the ground cross-legged is normal, sitting on a chair and crossing your legs isn't bad. bad for you. But if you are missing some basic natural ranges of motion that you should have, then there's a world where it's absolutely understandable that somebody doesn't feel comfortable in that environment. So as always, please let me know in the comments down below which one of those exercises did you feel had the biggest impact. And if you did find this video helpful, I would appreciate you liking the video, subscribe to the channel if you want more content from me. We are so close to 100,000 subscribers. Please jump on board before then. If you want a little bit more detail on some of those hip muscle stretches, please consider becoming a member. But as always, thank you again for watching. I hope your knee is immediately feeling better to some degree, and I'll see you next time.